हेलो गाइस, वेलकम बैक टू न्यू वीडियो ऑफ मेडिकल। तो मेरा नाम है आकाश। तो आज के हम वीडियो में देखेंगे ग्रॉस स्पेसिमेन फॉर सर्जरी। ओके, सो हम बहुत ही कम स्पेसिमेन डिस्कस करेंगे, पर जिस तरह से पूछेंगे वो डिस्कस करेंगे। ठीक है, तो पहले आप देख सकते हो ये इतने सारे ग्रॉस स्पेसिमेन है। ठीक है, तो ग्रॉस स्पेसिमेन बोलने ऐसा सडनली आप आंसर मत बोल देना। ठीक है, पहले आप उसको देखो, ऐसा एक्ट करो कि आप देख रहे हो। ठीक है, फिर बाद में उसको आइडेंटिफाई करो और अगर वो पूछेंगे तो क्वेश्चन बोलो और क्या पैथोलॉजी है वो बोलो। ठीक है, पहले नॉर्मल एनाटॉमी का स्ट्रक्चर बोलो क्या है, उसके बाद क्या पैथोलॉजी है वो बोलो। ठीक है, और स्टार्टिंग में बोल देना दिस इज अ ग्लास जार कंटेनिंग ए स्पेसिमेन ऑफ सो एंड सो, ऐसा चालू कर देना। ठीक है, तो पहले हम चलते हैं हमारे पहले स्पेसिमेन की तरफ। ठीक है, सो दिस इज अ ग्लास जार कंटेनिंग ए स्पेसिमेन। सो स्पेसिमेन ग्रॉस स्पेसिमेन, सो here you can see renal, this is a some kind of a renal thing. Here you can see the renal calyx, pelvis, and upper on the upper part you can see some pathology is there, and this can be most probably a kidney with renal cell carcinoma on the upper side. Okay, so this is the first specimen. So moving on to the next specimen. Okay, so here you can see these are multiple. Here is a glass jar containing a multiple cut sections. Okay, so this is actually I know the answer. This is nothing but a cut section of the TB lymph nodes. Okay, sorry, lymph node cut sections. Okay, not TB also. How we can identify? You can tell these are the capsule-like structures with outer cortex, inner medulla, and bean shaped. Okay, so by this we can tell these are the cut section of the lymph nodes. So next, moving on to the next gross specimen. Okay, here you can see this is a finger. Okay, so some finger is there, and this is some cross section which is amputation is done. Okay, so you can, this is a and this is blackish in color, which indicates a dry gangrene. Okay, so this is a gangrene of the toe, which is a amputation. So which incision is taken and which kind of surgery is taken, what are the types of amputation, that all will be asked in this. Okay, so moving on to the next gross specimen. Okay, so here you can see this is a skin, this is a nipple, and this is the areola. Okay, and most probably it will be breast carcinoma only. Everywhere it is common only, but you should tell normal anatomy, like whatever you can see, this is the fat, skin, everything. Okay, so pathology is here behind. Okay, here backside some pathology is there. So most probably this is a breast carcinoma. What are the risk factors for breast carcinoma? What is the treatment? What is the modified radical mastectomy? What are the surgeries? What are the other questions which are available on breast carcinoma? You should read and come. Okay, so moving on to the next gross specimen. So here you can see, okay, these are nothing but this is gastric rugae. Okay, so this is a gastrectomy specimen. So here you can see this is the pathology, and backside also pathology is there. So you can see the lesser curvature and the greater curvature and the gastric rugae. So this is the stomach, and most probably this is the stomach carcinoma. So what are the types of stomach carcinoma? What are the risk factors? What causes stomach carcinoma? What everything about the specimen you should know. If they just tell to identify the specimen, you should tell the specimen, or else if they ask questions, you should answer that also. Okay, so moving on to the most easy and most common one. So here you can see this is the tubular structures with an opening and a blind end. Okay, so most probably this is appendix. Okay, appendicitis. So this is appendicectomy. What are the types of appendicectomy? What is the surgery given? What is the incision given? What is Alvarado scoring, etc. What all related to appendicectomy they might ask. And you can see mesoappendix also, like some kind of peritoneum is present. Okay, so this is the appendicectomy specimen. What are the types of appendicectomy? What are the incision given? Everything related to appendicectomy they might ask, like Alvarado scoring, everything. Okay, so these are the most common specimens which are present in every college. I hope.
So guys, moving on to some more specimens. Okay, this one is the one more most common specimen is this is a gall bladder stone. Okay, so here you can see this is a hollow tubular like sac like structure. Okay, this is a sac like structure and along with the stone. Okay, the most commonly it will be a gall bladder stone. Okay, and another one thing, the sac will be like greenish type in color, then also it can be gallbladder. Okay, so you can see a sac like structure along with the stones at the bottom. The most commonly it will be gallbladder stone. Okay, so this one is a large intestine gangrene. So majority whichever it is in your college, they might have already told like which specimen it is. So most commonly these kind of specimens will be very hard, so these things won't be kept. Okay, so this is a small intestine, most commonly Crohn's disease. Okay, so you should know the difference between ulcerative colitis and Crohn's disease. Okay, if they kept this intestine like large intestine or small intestine, most commonly they will ask the difference between ulcerative colitis and Crohn's disease. Okay, renal cell carcinoma, most common at every place, every college. Okay, so this is another specimen of the renal cell carcinoma. So one more thing, renal cell carcinoma at the upper side. Another one is teratoma of ovary. Like all three germ layers will be present, like ectoderm, mesodome, endoderm, rocky turnkey, protuberance, hairs, teeth, that will be present. Okay, fibroadenoma breast, this is a benign condition. You can see this is a fibroadenoma. Another one is hydatid cyst. Okay, if your college has hydatid cyst, it may be this white color hollow white color balls. Okay, white color balls which will be filled with a fluid. Okay, so hydatid cyst may be present. Stomach carcinoma, the teratoma, This seminoma is very rare. Like if they have kept this will be present most commonly in pathology. Like if it's in surgery, it's fine. Another one is trichobizarre. Okay, psychological condition where you will eat hairs. Okay, and a ball of hair will be removed from your stomach. Okay, this is trichobizarre. This might also be kept. It's up to your college. Okay, this one is a right hemicolectomy. So you can see ileum is there here, and here it is the cecum and the large intestine thing. Okay, so most commonly right hemicolectomy done at the colon cancer. Okay, so you can tell this one is a specimen. First identify the anatomy, then at the pathology. Okay, so thyroid gland might also be kept. Okay, most commonly it will be thyroid carcinoma or a toxic nodule or anything related to thyroid. Okay, so you first tell there are two lobes are there along with the isthmus at the present, and you can see it will color you can tell, and multiple lobules. So this might be a thyroid carcinoma, you can tell like this. Okay, so next thing they might keep gallstones. Okay, like there are three types of gallstones: cholesterol stones, pigment stones, and mixed stones. I will tell the difference soon. Okay, so another one here you can see, this is a pancreaticoduodenectomy. So this one is just extra thing you should know. Okay, so what all are there? Here is a gallbladder is there, here pancreas head is there, and here is the duodenum. Here you can see it is rear duodenum. Most commonly this might be Whipple's procedure. Okay, so they will remove these things: gallbladder, head of the pancreas, duodenum, and they will do triple anastomosis. Okay, this is a Whipple procedure. Then mixed stones, cholesterol stones. Okay, this is a nephrectomy specimen. Okay, here you can see there are multiple cyst-like structures. This is a polycystic kidney disease, so bilateral nephrectomy can done here. Okay, this one is a proctosigmoidectomy. Okay, proctosigmoidectomy most commonly done for ulcerative colitis. Okay, because ulcerative colitis is most commonly present in the anus, and Crohn's disease is present everywhere. Okay, because split lesions are seen in Crohn's disease, but ulcerative colitis is continuous. Okay, so next is hydatid cyst. This is the thing. These are the extra specimen. So here you can see I have made a table of the types of the gallbladder stones. Okay, so gallbladder stones, so most commonly there are three types: cholesterol stones, pigment stones, and mixed stones. Okay, so these are the most three common things, and it is most asked Viva questions also. Okay, so cholesterol stones made up of cholesterol, they are pale yellow and white in color. Okay, consistency is hard and they are radiolucent. Black pigment stones, they are made up of calcium bilirubinate, they are black in color, they are hard and brittle. Brown pigment stones, okay, this is black, this is brown in color because they have fatty acid and calcium bilirubinate, they are brown in color. Okay, they are soft and greasy. Mixed stones contains of cholesterol stones, pigment, both, it is mixture of both the things. Okay, so three types: cholesterol stones, pigment stones, and mixed stones. Okay, so cholesterol stones most common in western countries. Mixed stones are because of chronic elderly and chronic hemolysis and Asians. Okay, and most common present in India, that is mixed stones. Okay, so this is the tabular column. You can take screenshot or you can read it. Okay, so fix the color of the stones in your mind. Okay, so cholesterol stones, they are yellowish white or whitish in color. Okay, and pigment stones, they are mulberry shaped, they can be black pigment stones or white pigment stones. Okay, another one is calcium carbonate, they are white in color. Another is mixed gallstones. Okay, they can be of like mixed of cholesterol and pigment stones. Okay, so these are the things. Fix this in your mind also. These are the types of gallstones. If they asked, if they rarely ask, but if they ask what is the type of the gallstone, so you should tell it. Okay, so now another one ask question, like if they want, they can ask, okay, what are the types of renal stones? Okay, they can ask calcium, they are calcium oxalate, they contain composition of calcium oxalate only, calcium oxalate monohydrate, calcium phosphate stones, struoid stones. Okay, they are triple phosphate stones, magnesium, ammonium, and phosphate. Okay, these are the Stragon calculi. Okay, uric acid stones, next one is cysteine stones, which causes cystinuria, and xanthine stones, which because of xanthine oxidase enzyme deficiency. Okay, cysteine stones and xanthine stones are rare. Okay, uric acid stones, struoid stones, calcium phosphate stones, and calcium oxalate stones. Okay, so most common, you should remember, there are only two are radiolucent. Okay, only two are radiolucent, that is uric acid and xanthine stones are radiolucent. Remaining all are radiopaque. Means radiopaque means they are visible on the X-ray. Radiolucent means they are not visible on the X-ray. Okay, so this is about renal stones. Okay, if you want to take screenshot also, you can use for quick reference. Okay.
Somebody